These numbers are staggering. We're already in a position where this is a crisis that has spun completely out of control.
The opioid crisis in Alberta is killing more people than it ever has. And those close to the issue say without action, this disturbing trend is here to stay. New data from the Alberta government shows between January and July, 898 Albertans died of a drug overdose, 96% being opioids. That's compared to 735 in that time period last year.
Without serious and concerted, focused effort on many fronts, including supervised consumption sites, safe supply initiatives, and just a massive expansion of harm reduction services back to way beyond even where they were in 2019, which has been cut down significantly, we're going to see continued deaths.
The UCP government has put a large focus on recovery and abstinence programs and taken funding and focus away from supervised consumption sites and supplying safe substances.
I take about 24 milligrams in the morning. So that's a very sizable dose of Dilaudid. And I'm on it right now. I'm able to speak properly. I'm able to work. I'm able to be productive. It doesn't interfere with my life in any of those negative ways.
Ophelia Cara is a client at SafeWorks and says she's the only Albertan receiving IV opiates. After being addicted to heroin, she says this has given her some normalcy.
I was very lucky that I managed to find a doctor who was willing to prescribe me Dilaudid. There have been some really, really significant changes happening in my life.
As a drug addict and advocate, Cara uses social media to help destigmatize harm reduction. Meanwhile, Thompson says frontline workers are in the trenches, begging for more to be done.
There's a ton of burnout going on right now. People are working similar to what we're seeing in the COVID crisis in the hospitals. They're right now just in emergency mode all the time, responding to overdoses in the streets.
Minister for Mental Health and Addictions Mike Ellis said Alberta's government is exploring options for new supervised consumption services in underserved areas of Edmonton. The opposition NDP's Lori Sigurdsson said her government is proposing expanding supervised consumption services, providing safe, regulated alternatives to highly toxic and illegal street drugs, and making drug testing easily available. In Calgary, Taylor Brott, City News.